Hi, my name is Greg Feld, Director of Public Health in Sheffield. This is a quick COVID epidemiology update of the 13th of September. So case rates have slightly increased over the last 7 days. I suspect they'll fluctuate over a period of time now until we get further into the autumn. Increased against a high baseline. So currently between 300 and 350, they increased a little bit. They'll fluctuate, they'll go down a little bit. The main increase has been in 11 to 17-year-olds, obviously linked to high level of testing in preparation for returning to school. So we're a week into that now, and that will probably settle over time. The case rates are high in the 18 to 55 age group. Most hospital admissions at the moment, and there are people in hospital with severe illness due to COVID, are in the 35 to 45-50 cohort, and almost exclusively unvaccinated people. Whilst the harm from COVID is very, very, very age-driven, most of the older people are now fairly well vaccinated. There are still significant numbers of younger adults who aren't vaccinated, and some of those are sadly coming to harm and ending up in a hospital bed. So the increase in over 65 case rates, which we've seen over the last 2-3 weeks or so, is levelling off, but again at a higher rate than is comfortable, and again I think will fluctuate over a period of time. A well-vaccinated group, so relatively little developing severe enough illness to need a hospital bed, but no one can ever guarantee that won't happen. Even well-vaccinated people, there's still some risk, and I still think it warrants some care, so the usual protective measures, avoiding people with symptoms. Obviously, if you've got symptoms, stay at home, hand washing, face coverings. I would still wear my face covering in closed public spaces. Bed occupancy hospital is high and largely unchanged. The rate at which new people are diagnosed is about the same at the rate of, new people admitted to hospital is about the same rate as which people are discharged, and too high for comfort number of people in the hospital bed, which is very much too high for comfort if you're one of those people, obviously. And that's much too high a baseline going into the autumn. So we like to think this is all over. It's definitely not over. COVID will be with us for some time to come, and sadly there's a resurgence is too strong a word, but there's certainly an increase in the number of people who are sadly dying with severe COVID. Very, very small number of people, but certainly there. Vaccination, lastly, on epidemiology. About 73% of the adult population are vaccinated. That means about 27% of the adult population are not vaccinated. Again, it's the most important thing you can do to protect yourself from severe illness. So if you haven't yet had your dose, then please do so. We have a number of walk-ins across the city, as well as walk-in clinics at Longley and Darnell Primary Care Centre this weekend. Crystal Peak Shopping Mall is open, so if you want to pop along, have your jab. You don't need to book, you don't even need to be registered with a GP, and you can have your second dose at a walk-in clinic. It remains the most important thing you can do, and it isn't too late. So where are we going on all of this? So we want COVID to be over. It's not going to be over any time before, certainly into the new calendar year, possibly a bit beyond, and I wouldn't want to predict beyond that. We all want to see some return to normality, as do I. And, we're seeing plenty of return to normality. We're a long way past step forward the roadmap. However, we've still got high rates of transmission, and you've heard me talk about the epidemiology of that. There are 5 things that broadly lead to the rates of COVID transmission. 1, the Delta variant. 100% of our cases just about are Delta variant. That leads to increased cases, that leads to increased harm. Delta is good in a fight, and it outcompetes other variants, and I'm not seeing any signs of any other variants. Second, vaccine inequality. 73% of the population in Sheffield are fully vaccinated, or the adult population, that's good. Don't be fooled by the average. 73% are fully protected, but that will be much higher in some communities and much, much, much lower in other communities, and we're trying hard to get all of our communities as fully vaccinated as possible. Social mixing, we all want it to be over. More contacts equals more opportunities for the virus to spread, so please be careful in that space. Inconsistent use of public health messages. Mask wearing is pretty low at the moment, actually. Mask wearing has made a difference. And if we want to limit transmission, sometimes wearing masks might be a helpful thing to do. Hand hygiene, ventilation, opening the windows, distance, most importantly, testing if you have symptoms and isolation if you get a positive test. Misinformation is also allowing the virus to thrive. There are lots of susceptible people out there. So on misinformation, I'm reading a lot about vaccines don't work. It is wrong, bluntly wrong. Vaccines do work. Vaccines massively reduce the risk of hospitalisation and death in a way that's way more positive than I dared hope for. Data published last week by Public Health England, vaccination reduces the risk of hospitalisation of an 80-year-old to that of a 30-year-old. So reduces it from really high rates or high risk to a very, very, very low risk. Not zero, but very low. Less effective in terms of reducing transmission, and I'll come back onto that. But there are still lots and lots of unvaccinated people out there, and I fear that lots of people are choosing to not be vaccinated because they believe what they see on various forms of social media. Let me be clear, vaccinations are hugely important in reducing your risk of hospitalisation and or death, and there are lots of people in hospital. So the best place to look for vaccine information is either a gov.uk website, an nhs.uk website, or to be fair, the BBC have some very, very good information on vaccination. ICUs are full of people who haven't been vaccinated, or not full, but they have significant numbers of people who haven't been vaccinated. Lots are fearful on account of what they read on social media, and that misinformation is not benign and it is harming people. There are people who still get infected, become poorly and have a positive test, who are fully vaccinated. The vaccination isn't 100% effective at reducing transmission. So just by weight of sheer numbers, the number of people who are vaccinated in the 40 to 79 age group, just by necessity, most infections are going to be in that age group because they're going to be in vaccinated people. The sheer numbers make it that so, but most of the harm will be in the non-vaccinated group. We expect a policy decision on 12 to 15-year-old children this week. Whilst we're looking at that, it's important not to lose sight that there are still many over 50s who aren't fully vaccinated. And if we want to reduce harm, that's where we will reduce the harm the most. And I encourage anyone that's over 50 that hasn't yet been vaccinated to consider that really urgently. So to be clear, COVID isn't over. COVID is still harming people. It's definitely not just the flu. And to be fair, flu harms people every year. COVID is just the same. It's not true that only people with pre-existing health conditions are getting sick. Fit and well people who are unvaccinated are getting sick, and some of them quite seriously sick, and vaccination really reduces the risk of hospitalisation, ICU admission and death from COVID.